Okay, let's get going today. I suspect there'll be some more people joining us soon, but I don't want to delay for those who are already here. My name is Mark Cooper. I am the president and CEO of the Saskatchewan Construction Association, and happy today to co-host this meeting with several other organizations that have helped to get the word out to all construction companies in the B-rate codes across Saskatchewan. To have a conversation today about on-site safety management in the era of COVID-19. Today's conversation focuses primarily on non-residential construction. Tomorrow there will be a similar conversation at the same time, so from 11 to 12:30 with a specific focus on residential construction. And so looking forward to that. And if you operate in both spheres, then both of these conversations may be of value to you. The other organizations that are partnering with the Saskatchewan Construction Association to deliver this town hall today include Merit Contractors, the Regina Home Builders Association, the Saskatoon Home Builders Association, the Saskatchewan Construction Safety Association, and one of our panelists joins us from them today, and we'll hear from Loy in a few moments. And also WorkSafe Saskatchewan, so WCB, and Annette Gosky has joined us from WorkSafe. And Annette, I'd like to give you a moment to say a couple of words here before we dive into to the town hall.
Sure, thank you, Mark. First of all, I want to say thank you to Mark and the rest of the people involved in organizing this initiative. Very important thing to do in this time of unprecedented times with the COVID-19 pandemic that is going on around the world. So thank you so much for allowing WorkSafe to be part of this. I hope you find the information that, or the town hall meeting very informative and gives you some next steps as you go out to continue to work out there in your industry. We do want everybody to be safe out there as best we can in these times, and a very important initiative today. So thank you, Mark, for organizing this. Thank you for allowing WorkSafe to be a part of this. And I will turn it back over to Mark and the panel to keep the ball rolling on this meeting today.
Thank you, Annette. Really appreciate that. Let's start by introducing our panelists. So I'm going to just ask them individually to introduce themselves, say a little bit about their background, and I want to start by thanking all of them for volunteering their time to be here today. They're all extremely busy trying to deal with these issues for their own organizations, and I'm extraordinarily grateful to them and to their organizations for allowing them to be part of the call today. Loy, let's start with you. Could you introduce yourself, please?
Yes, good morning, everybody. I am Loy Levesque. I'm the Advisory Services Manager at the Saskatchewan Construction Safety Association. As many of you know, or probably know, we are the safety association for building construction in Saskatchewan. I have been with them for 8 years now, and we do have a team of advisors that have been working very hard to help everybody through all the changes that have happened in the last couple of weeks.
Thanks, Loy. Ryan.
I'm Ryan Smotra. I'm the Regional HSE Manager for Saskatchewan for Graham Construction. I've been working in safety for about 20 years now within the construction industry across all over Western Canada. Hopefully be able to support industry a little bit and answer some questions for you.
Thank you, Ryan. Mark.
Morning, everybody. Mark Novecosky. I'm the Regional HSE Manager for Flynn Group of Companies. I look after the Prairie region, so all of Saskatchewan and Manitoba. Similar story to Ryan. I got about 20 years safety experience, about 10 of those in construction with Flynn. And I'm also the chair of the SCSA. Yeah, looking forward to some challenging questions today, and hopefully we can provide some guidance to you folks. Thanks.
Perfect. Thank you, Mark. Giorgio.
So I'm Giorgio Grebaz. I'm the Regina District Manager for our HSE Manager for PCL, and my background, I've got 32 years of construction experience, 20 in safety. I just recently came on board with PCL, but I ran my own safety consulting company for 12 years before that. So like the rest of the group, hopefully we can answer some of your questions and get the information out to the industry.
Thank you, Giorgio. And Amanda.
Hey everyone, I'm Amanda Fick, the Director of Operations for the Saskatchewan Construction Association. As Mark has mentioned, I'm kind of here just to help with any sort of question and answers that you have and ensuring we get those down to our panelists and answering any questions on behalf of some of the business supports that are out there if they do come up.
Perfect. Thank you, Amanda. Thanks to all of our panelists. Just before we dive into our first question, I want to give people a short background on why we're doing this. So as all of you know, construction has been defined by the provincial government as an allowable business, meaning that construction sites, assuming that they're able to be made safe and to ensure the safety of workers on those sites, are allowed to continue operations. That's a good thing for our industry, but of course it's predicated on the concept that we can make those sites safe and ensure the safety of our workers. And given how critically important that is always, but particularly right now, we wanted to have a specific conversation about what are the risks today with respect to on-site safety that perhaps didn't exist before COVID-19 or we weren't as focused on before COVID-19. How are we mitigating and how should we mitigate and manage those risks? And what are some of the best practices that companies are seeing or doing that you can implement as a contractor on your sites and things like that. And so that's really what the focus of the conversation is today. And so let's start with the very first question. And maybe Giorgio will start with you on that, is how are you making decisions on site and as a company about what you're required to do for health and safety in these days with COVID-19?
So our company has established a pandemic response group, which within each district aligns with our corporate pandemic group. And in Regina, we align ourselves with the government of Saskatchewan as well as the health agencies protocols to ensure that we're complying with what's out there. So really that's it.
Right, so you're really taking your direction from the advice and guidance being provided by government agencies and public health officials, right? Yeah.
Absolutely.
Okay. Ryan, same question to you.
Well, very similar to what Giorgio says, we have a group that's been designated to make a lot of the decisions through senior management. One of the things too with this is because it's such a fluid situation, being able to make sure that you also have somebody designated to make sure that you're keeping up with all of the communications that are coming out from it, from the different ministries as well as the government, and making sure that, you know, as those changes happen, you're able to react and review them and stay up to date on what is going on, because what was happening last week or yesterday may be different today.
Yeah, that's a really good point, Ryan. So Mark, let me ask you that. I assume that for Flynn, it's largely the same, that you're taking your direction from public health officials and from government, but how are you, or what's your company doing to stay on top of what those rules are and how they're changing?
So yeah, good question. Yeah, we very similar answers to what the other folks said. We do have a corporate pandemic task team. We basically make sure that task team has rolled out not just from our corporate leadership, but down to each individual branch and even the job sites. So what we've tried to focus on is making sure that we have a single chain of communication, and we have dedicated people to make sure that we're abreast of all changes, and that includes any additional emergency responses expected, any government demands, requirements, any of that sort of stuff.
And just to further on that, from what Mark said, it is really good for a company to have a single point of contact making the decisions to maintain consistency across all sites or in all your locations.
Good point, Ryan. So Loy, let me ask your perspective on that. I mean, SCSA is obviously a place where people can go to get information and support. But what are you hearing from contractors around how they're making these decisions on site? And what advice do you have for folks that maybe builds on what we've heard from Giorgio, Ryan, and Mark?
Well, I think the three of them covered it fairly clearly. What we're doing at the SCSA is making sure we're staying in contact with our strategic partners. We are a member of the Canadian Federation of Construction Safety Associations, so maintaining contact with the other associations, finding out what they are doing to handle the pandemic and recommending to their employers. Every province is different, obviously, in where they're at with the pandemic right now, but we're looking to be ready when that next level comes, going off of communication with our partners.
Fantastic, thanks. A reminder to folks on the call that if you do have questions, you can use the Q&A function at the bottom of the Zoom to put your questions in there, and we will get to them. The next question I have, maybe we'll start with you, Ryan, is you know, everybody's dealing with a lot of fear and uncertainty. That's true, I think, for really everybody right now in this time. And that's creating definitely some challenges on site, including perhaps reduced productivity, the possibility of reduced focus, things like that, and heightened awareness of things like, you know, people sneezing or coughing on site and things like that. So in a time when we're all trying to make decisions based on evidence and facts, not fear, what's your company doing to handle this? And what recommendations would you have for others who are on the call about what they can do to help manage that fear?
Well, there's a few things. It's a big question with a lot of questions in it. First of all, the productivity discussion or a point that you brought up, because I know that's a big concern for a lot of the contractors out there. You know, being able to stay productive and maintain profitability while we're working under the conditions that we're in right now to maintain the bids that we've put in. And one of the things that I've seen and that we've witnessed is, you know, a lot of innovation and effort and work that the workers are putting in, our supervision. The people in Saskatchewan come up with innovative solutions to make things work and make them effective. People want the general workforce wants to work, but they want to work safe. They want to be healthy when they go home to their families. And so, you know, from the experience so far, first thing is giving workers the opportunity to provide feedback on improving their health and safety in their workplace. We want to make sure that as we're going out there, it's a long list of things. Evaluating your workers upon coming to site, making sure that they aren't showing any symptoms, haven't had any concern exposure limits or concern of exposures, are isolating if they're required, following their recommendations from doctors and the health ministry. Obviously ramping up hygiene on site. So this includes sanitization of lunch and office facilities, making sure the site's staying sanitized. Things like, you know, it's easy when you go out to the field to get ideas, staggering breaks, keeping people, staggering lunches, you know, setting up work in different manner. For the most part, the construction industry in Saskatchewan is fairly innovative and have been, from what I've seen, quick to respond. The contractors out there are providing innovative solutions all the time. We need to make sure that as contractors that we're providing our workforce the things they need, cleaning supplies, and I know right now it's a lot of that stuff's difficult to get a hold of. You know, it's an ongoing difficulty, but making sure people are coming in healthy, following regulations from the government requirements, making sure they haven't been exposed, maintaining proper hygiene on the site, maintaining sanitization on the site, re-looking at how you're performing work. So setting up work in different ways, scheduling on site on how work is being performed or when work is being performed. There's a number of sites that are starting earlier for some contractors and then ending later for others, so that there's a staggered time when workforce is on the project. And you know, without question, there's going to be some short-term difficulties. This isn't going to be normal day-to-day practices that we're all used to, and you know, the 9 to 5. There are going to be some additional requirements that I wish I could say, well, it's easy and you know, it's you know, business as usual, but we're going to have to work a little bit differently and a little bit harder and take some additional precautions. That is, you know, the reality of the situation. But from what I've seen and you know, across all of our projects in the province, all the contractors in the construction industry are willing to step up. They want to step up, and the workers themselves are taking the precautions they need to protect themselves. They want to go home safe. So, you know, it's us providing them that opportunity.
Thanks, Ryan. So it really sounds like you're saying, you know, if contractors are, of course, communicating and engaging with their employees, and they're following all of the protocols and procedures and making sure those things are available, that helps alleviate a lot of or can help alleviate a lot of the fear and concern, right? People need to see that stuff's being taken seriously.
Absolutely. You know, take the time to analyze it. We're going to have to put in additional supervision, some additional planning, but you know, taking the time to do it, it'll pay off long term for the industry and support a healthy workforce.
Okay, perfect. Thanks, Ryan. I'm starting to see some questions coming in, which is great. Giorgio, Mark, or Loy, anything that you'd like to add to Ryan's answer about how you're helping your folks manage fear?
Mark here. A quick comment. The health and safety of our workers always and will be our #1 focus. That hasn't changed pre-pandemic or currently. So we can't forget about all the other risk mitigation that we do throughout the day and throughout our job sites. Of course, today we're talking about pandemic, but that doesn't mean that we forget about talking about the other stuff on our job sites. So it's just an added responsibility moving forward. And honestly, to kind of add on to what Ryan is saying, he used the word evolution. This is an evolution that's probably going to go beyond pandemic, where companies in Saskatchewan are, like you said, finding innovative ways to keep our workers safe. They're finding innovative ways to be more efficient and maintain efficiencies and productivity on job sites. You know, whether that is using technology like we're using today, like Zoom or Skype or Microsoft Teams, for doing meetings remotely versus, you know, having everybody tightly knit in a job trailer. There's so many examples. Like Ryan said, we could talk all day just on that topic.
Okay. Loy, I know you wanted to add something.
Yes, I think just to add on to what Ryan and Mark both said, communication is going to be key in trying to manage the fear of workers on site. There is so much information flying around right now regarding COVID-19. It's really important to be the source of truth and be honest and upfront with the workers on the measures that you're taking to protect them. Involve them in that, ask for their feedback and ideas as well. I think talking about it is one of the ways that we can really get rid of the fear that's brought on by so much misinformation happening, and rather be specific to what you are doing on your specific site to protect them.
Thanks, Lloyd. Giorgio, do you want to add anything to that?
Yeah, I think the biggest thing out there in curbing the fear out there is making sure that you're providing the workers with factual information. There's a lot of rumors that fly around, a lot of hearsay, and we want to make sure that it's fact-based when we're actually providing information to our supervision to get down to our workers. That's the key thing, and sharing what happens on one site with the rest of the sites, so that when the information does get to the other sites, it's a factual-based conversation, not hearsay and rumors from other sites that are going to the next ones.
Thanks, Giorgio. Okay, we're going to move to some of the questions from the audience, and we'll come back to some of our prepared questions in a bit. But this first one, Loy, I'm going to come to you from. It's from Paramount, and the question is, can employees share tools? It
is not recommended for employees to be sharing tools right now. However, in some circumstances, I know that is going to happen. So there has to be a cleaning process involved. Every time you're finished with the tool, you should disinfect it, wash it properly. And to be on the safe side, if you're going to use a tool that someone has used, take it upon yourself, wash it off yourself before using it.
Okay, and so basically it's not recommended. Anybody want to add to that? Okay. So first of all, Bob Zerman, yes, we'll come to you in a second for a question. So hold on, and I'll let you speak in a second. We're going to get through a few other questions. So the next question is from Justin. I guess I'm going to paraphrase this question and say, what additional or new safety requirements should contractors be considering to implement now to ensure that construction can continue to be allowable? And Mark, maybe I'll start with you on this one. And maybe if you could run us through sort of some of the new things that you're doing from before people get on site, right? And sort of throughout the day, what new practices you have in place today that maybe you didn't before COVID-19.
I'll maybe start by saying that even before we get to site, everybody gets pre-screened, kind of a health check, I guess would be the best way to say it. So we know that when we hit site, we can hit the ground running with happy, healthy employees. And I think that's really important. And I think it's expected that when other folks are on a job site, whether it's within your own crews or you're working with other trades, that everybody on site is there because they're safe and allowed to do so based on public guidelines as far as screening. So and I think pretty much every general contractor would echo that that's kind of expected on their job sites. We're discouraging, at least in our company, and I think most of the folks would say that we're discouraging the use of public transit. We're discouraging carpooling. If you're working for a trade that maybe it's your job to drive people back and forth to site in a crew truck, we're not recommending that you squeeze five or six people in a crew truck and haul them to site. If that means more trips to site, so be it. You're just reducing the risk by doing so. We talked a little bit about sharing tools and equipment. So before that even happens, I'm assuming that most folks have at least we have taken a look at our job sequencing, as Ryan mentioned earlier, and actually looking at, how is a task done now and how can it be done in the future and going forward, thinking of social distancing measures and thinking about lowering the risk of exposure when working alongside somebody. So can it be done with one person versus two or two versus four? How can we lower the time when people are working in close-knit situations? Sometimes that involves just physically job sequencing. Sometimes that involves more equipment, lifting tools, that sort of stuff. In our workforce, we do a lot of material handling, and by adding more equipment to site, we're able to do that in most cases, if not all, with one single person. Probably missing a bunch of stuff here, but so besides job sequencing, Lloyd had mentioned cleaning tools and equipment. Again, we're discouraging sharing of tools and equipment, but of course, everybody, it's more than just a $30 hand tool. Sometimes we're talking about equipment that's thousands of dollars in cost, and we can't have dozens of those on site from a practical standpoint. So you may have to have sharing of that large equipment, and it does involve a cleaning process and a cleaning procedure. I recommend that all contractors actually have a written procedure or written job safety analysis for that, job hazard analysis. Yeah, all the other stuff I think has already been talked about, including staggering of breaks. In some cases, if it's permissible with lighting and so on, even having split shifts on the job site, and that's going to become more and more possible as our sunlight increases right over the next few months. So I'm sure other folks are looking at that as well. And that's all I can think of at the top of my head. I could probably think of more in 5 minutes. So.
Well, you'll have a chance to say more. Let's maybe go to Giorgio next for anything you'd like to add to Mark. So this is what additional requirements people should be putting in place now that maybe there weren't there before COVID-19. So anything that you'd like to add to what we've heard from Mark?
It's quite difficult question to kind of ask because we don't know what every task is. So to try and take a look at every task and say what we can do or can't do, there's options. I mean, we've got to take a look at the distancing, but if that's not an option, we can look at other precautions put in place, face shields, things of that nature, other PPE, Tyvek coveralls. We can add those in there. But these guys have kind of already covered a lot of the things that we do have on the sites. So we're following suit with the rest of these.
Okay. Ryan, anything you'd like to add?
Yeah, a couple other, and Mark kind of touched on it. Having written procedures for the sites so that they understand it. And I know right now we're in the world of conference calls and video chats like we're at right now, but actually having documented step-by-step procedures and even checklists, making sure stuff's done properly is a key to ensuring consistency on it. A couple other things we're used to on a lot of job sites, and we have contractors on our sites with trailers. Reducing visitors between sites is also very important. We're having a lot of delivery personnel or the stop-in people that are coming in, limiting them from coming into lunch trailers or site offices. Set your meetings outside, maintain your physical distance from them, and allow them to drop off the material or equipment or deliveries. So trying to maintain that process between sites. One of the other things ourselves and a lot of the other contractors face as well is one supervisor I've witnessed one supervisor for many different projects. So we have a number of staff as well that travel between the projects. So setting out specific guidelines for those type of people individually, because if you do have a problem on one site, you don't want it to be a problem on all of your sites. So setting out specific guidelines like anybody traveling between sites, maintain social distance, stay out of lunchrooms, stay out of office trailers, wash hands on the sites. And I know we're very used to using the hand sanitizer, get used to that as well. One of the things that's recently been identified to me was hand sanitizer does work, of course. Soap works better. Soap and water is your best case. It's the membrane on the COVID virus is fat-based or lipid-based, and soap breaks it down very, very quickly. So washing your hands properly with soap and water is your best option. And I know there's, a shortage out there of the hand sanitizer, the alcohol-based hand sanitizer. So feel free to use that soap and water. It's a really good idea, but travel between sites should be limited as much as possible. Make sure that those people that are moving between your projects understand that there's an additional responsibility on them to make sure that they're protecting all the sites. So, and you had mentioned too with the trucks, reducing as much as possible. And I know there's been discussion coming out regarding what the allowable, what the occupational health and safety guidelines are going to be for allowing that. So reduction of number of people in a vehicle whenever possible. My recommendation is no more than one. One person in a vehicle at a time. One of the things that is a key thing in vehicles, especially in shared equipment, that steering wheel in a vehicle needs to be wiped down and cleaned regularly. That is a point where a lot of the workers take off their gloves when they get into a truck, or if they don't, they're leaving their gloves on, and the next person may not. So making sure that steering wheel is cleaned is a critical portion. Having your list of stuff that needs to be sanitized, and like I said, having that documented. as a continuous reminder to make sure that supervision have the opportunity to review it, understand what they need to do, and are following on a consistent basis.
Thanks, Ryan. Lloyd, the next question I'm going to start off with you anyway, so I'll just see if you have anything you'd like to add to the answers we got from Mark, Giorgio, or Ryan about new practices that people should be implementing.
I would just like to expand on the sharing of work vehicles. I had some discussions yesterday and put that question forward. The fact is you cannot maintain social distancing in a vehicle, and it's really not practical to try and wear personal protective equipment in a vehicle to protect yourself. So that is, it's not allowed at this time.
Okay, thanks, Lloyd. The next question comes from Allison. Will the SCSA consider requesting an acceptance or approval from OHS to use N95 masks certified to a different standard so the industry can access product when required?
Okay, I don't have a specific answer for that right now, but we are waiting for some options on that. We have been in touch with LRWS to try and see what we can do. In the meantime, I know the N95 masks are hard to come by right now. So as soon as we get some information, we will make that available to everybody.
One thing I'll add to that too, we're waiting on, and I know there's discussions happening right now, and we're hoping to have in the next day or two approval from the ministry regarding the use of KN95 masks, which aren't approved for healthcare currently. They're considering them for use during healthcare just because of the shortage. So KN95 masks may also be an option. But again, just so everybody knows, we're waiting on full approval on that. It should be out here very, very quickly. So as I mentioned earlier about keeping up with the most current information, as soon as that comes out, that's a big opportunity for the construction industry to as an for us to continue to improve.
Thanks. This next question is just a specific example of some things that you could see in sites or workplaces or anything like that. What are you doing today for your portable water coolers? And anybody who has a answer or who has addressed something like that can unmute and kick at the can here. What are you doing for portable water coolers, Ryan?
We're recommending that workers bring their own personal water. I mean, we supply it whenever possible, and we're using sanitizing, process. But for now, I mean, we have an obligation to provide water to the workers or give an opportunity to have a place to fill it up. But we are definitely recommending workers bring their own water, bring your own water jug. It's not too difficult to fill up a 4-liter milk jug with water or whatever you want to bring to work. And, the temperatures are still cool enough that it's cold while you drink it throughout the day outside if you leave it out, so, for stuff like that, leave it in your car and on your coffee break. And a lot of workers are taking coffee breaks and lunch breaks in their vehicles now just as extra precaution. But, leave it in your car, fill up your water bottle. We're still providing water on our sites. And taking some additional cleaning precautions and having some expectations around that. But we're really recommending, from a personal standpoint and personal safety, bring your own water to site.
Okay. Anybody want to add to that? Okay. Next question comes from Charles Odette. Sort of a two-part question. We'll probably focus on the second part, but I will read it all, and we'll start with you, Giorgio. So, what are you telling your workers about building their immune system is part one, but second part that I'd like to focus on is how are you keeping up morale? Social distancing can be challenging, so how do you address morale for your teams?
So what we're doing on the morale part, Mark, is we're making sure that we're providing the guys with factual information, and we're stepping up all the cleaning procedures like all the rest of the guys have been saying. We're being visible about everything we do, which has really helped in the workers seeing that we do care about them and we're actually trying to make the site safer. So it's a visual thing for the most part. And then following that up with the information as far as changes go and keeping up in the front with changes as they come up.
Mark, anything you'd like to add to that?
I definitely echo what Giorgio says, and I'm glad for this question because I think folks' anxiety levels are can play havoc with reality sometimes. What I like to add, I guess, is some best practices of being very transparent about allowing for feedback opportunities, right from the newest workers all the way up and down through to top management. Like Giorgio said, being very transparent with factual information is important, and from top down, but from bottom up, allowing your folks, like Ryan had said, one of the original questions, allowing the field staff to provide actual solutions to some of these problems is really good, and it definitely provides some trust level.
Thanks, Mark. Lloyd, what's the SCSA recommending for helping people manage morale in these times?
Very much like Mark and Ryan have spoke about, maintaining communication. That really is the biggest thing right now. We're in a state of unrest, and with so much misinformation going around, we have to communicate the truth to people and be that source of the truth. Checking in on people. I know a lot of that can be done virtually in the office setting. On site, maybe at the morning toolbox talks, take just a couple of minutes to go around and see how everyone's doing. Just being really aware of your workers and if any of their habits changed or anything like that, be aware of it and maybe just have a conversation with them and make sure they're doing okay. And of course, asking them to bring their concerns forward so you can deal with them.
Thanks, Lloyd. Ryan, last word to you on this, on morale.
Number one thing, be honest at all times. If you don't know, don't make something up. Tell them, I got to find out. I'll get you an answer as quick as I can. Being responsible with the information that you have. You know, from what I've seen on the sites, you know, there was an initial wave of, you know, kind of concern. People are working well with each other. You know, everybody is aware that there's heightened concern out there and are supporting each other. You know, even conversations that I've had throughout industry and with different contractors in the last few weeks, first questions coming out, how are you doing? How's the family? Checking in on each other, making sure that we're all functioning well. You know, it's from a morale standpoint, it's going to come from the peers, from each other, and supporting your workers. You know, and like Giorgio and Mark said, you know, be honest with them, be open with them, and put in procedures and let them see it. Make sure it's obvious, and you know, keep it consistent.
Thanks, Ryan. I'm going to start with you for this next question, and we'll go to Giorgio. This comes from Corey Johnson. What suggestions would you have for ensuring compliance with trade contractors or subcontractors who may not have set pandemic preparedness plans? So on your sites as generals, how are you dealing with your trades who may not be as equipped as you might have been to tackle this? Ryan?
Well, when it comes down to if they're having a problem with it, we're having a problem with it. So our number one reaction at this point is support them as much as possible. Give them the tools that they need to be able to, you know, manage the, you know, provide them the documentation, we're doing worker screening coming onto our sites, support the process, communicate with them, and, you know, go support changes, provide ideas to them. You know, and I'll say it, we're seeing stuff that's working, that's supporting on one site. We're communicating that with another site, with other contractors. As an industry, we have to understand this isn't us and them situation. This is stuff that best practices need to be communicated across the entire construction industry. We want to keep working, so share safety information, share procedural changes, share what you're doing. We want, this isn't just about an individual worker or a company. We want to make sure that, and it's especially on us as generals, to be able to communicate that between sites, between contractors. We want to support everybody as much as we can.
Thanks, Ryan. Giorgio?
Just to echo what Ryan said, our trades are our extensions. They're part of us. So if they don't have the tools or the capability of doing that, we have to support them. We've got to give them the information and help them along the way. And from our standpoint, that's exactly what we do. All our communication that comes down from corporate to us as a district is passed on to our sites, and from our sites to our trades. So the information is relevant to anybody out there. And we want to make sure that they have the capability of ensuring the health and safety of their workers as much as ours. They are important to us. They're the guys that are doing the work. So we want to make sure that we can support them.
Thanks, Giorgio. Mark, from the perspective of a trade contractor who's probably working on sites with different generals and seeing different procedures and policies and things like that, what recommendations would you have for trade contractors in terms of what they should be doing to engage on site?
Don't try to change the world in one fell swoop. A lot of times, you don't need a 30-page document. A lot of times you can figure this out with a daily checklist or a daily risk hazard assessment. The other part is, don't say you're going to do something without having the tools and the knowledge to do it. So a few times over my safety career, even outside of pandemic, I've seen where you see a really great procedure from a company, but and they say they're going to use these specific devices or these cleaning products and what have you, and then when push comes to shove, they don't actually have the tools and training in place. So that all has to come with that as well. So hopefully that kind of makes sense from a common sense perspective, I guess. Yeah, I think that's what I'll have to say on that.
Okay, thanks, Mark. Loy, last word to you on that, and I'm also going to give an opportunity. I'm going to go to the next question and to you in a moment. So, if do you have anything you want to add to how trade contractors and how generals and trade should be interacting with each other on their job site with respect to COVID-19?
I think it's been covered already. If they don't have a pandemic plan in place at their own company, they will need to follow yours. So making sure they go through that orientation and know their expectations when coming onto your site.
Okay, Lloyd, I've got a few questions here, but this next one is on WCB. So just wondering what you can tell us about what are the implications. This comes from Thiessen. What are the implications of COVID-19 in regards to WCB and workplace injuries? If it can be connected back to a workplace exposure, are we going to see a rise in reportable injuries?
That's a really big question. Is Annette here still?
Actually, she is. I don't know if Annette, you heard that question. That's true, and are able to provide insight as to what the current WCB policy is on that. Oh, I know you're unmuted, but I can't hear you, Annette. Okay, we can't hear Annette. But my understanding is of that, and I'll just see if anybody has anything to add to that, is that WCB's further clarifications are that this is intended to apply to workplaces where the path of transmission is very obvious, and so healthcare is the best example of that. It would be really hard to verify in most cases that COVID-19 was contracted specifically on a job site, and the specifics of how WCB intends to record those and what the implications would be are still being determined. So I think the short answer to the question is, when it comes to construction, it's not clear at this point exactly how that will be all determined. Ryan, Giorgio, Mark, or Loy, anything you want to add to that based on what you understand?
Yeah, so one thing I guess is that it's really not up to us if you have an unfortunate event where you have a positive COVID on a job site, it's not up to us as contractors to reach out to other workers and tell them that they need to be tested. We leave that to the experts. The Sask Health Authority does that. and they'll make the determination as to, how that's going to be determined. Just like you mentioned, Mark, about WCB is still, working that out. It's true. And this is, this is an ever changing and expanding world we're living in as far as pandemic. So, what the folks are hearing today may evolve in a week and in a month. So that's kind of how it is right now, is we're leaving the experts be the experts.
And thanks to Giorgio, who posted on the chat the latest information from WCB right from their website. So for those who are interested, you can access that in the chat. Thanks, Giorgio. Ryan, did you want to add something?
Well, to be completely honest with you, it's, I don't know, nobody has a crystal ball on how this thing is going to go. We're going to see how WCB handles it in the future. Is it possible? Yeah, it's very possible that there's going to be a rise in it. How do you deal with it, or how is it going to be dealt with? For sure, it's going to, like any medical case or any single WCB case, it'll be a individual case by case basis. They'll make a determination. So what WCB ends up deciding will be what we'll go with. It'll be what it is.
Okay, thanks, Ryan. Lloyd, I'm going to come back to you for a question here from Tarns too. What specifically can we do if we have to work within 6 feet of each other? And they're an electrical contractor, but I know this is something you and I have discussed before, is in situations where you can't be outside of 6 feet, how do you mitigate that?
Okay, there's several things you can do to mitigate hazard when that happens. First and foremost, have a look at that job task, and you may need differently to really reduce the amount of time that you need to be working in a proximity closer than 6 feet to each other. When you're in those situations, very clear communication between the workers performing the task. For example, if one person needs to sneeze, something like that, they should remove themselves, sneeze, cough, whatever they need to do, sanitize their hands thoroughly before resuming the task that they were working on. Personal protective equipment should definitely be worn in these circumstances. So a mask, and I'm waiting more information on masks, and I'll share that when I get it. A mask, safety glasses, face shields, disposable non-latex gloves, all of those worn when you're working closely with someone else. And really try and reduce the amount of time that you need to be beside each other. So have a look at your safe work practice or your safe job procedures for that task, and really dig into it and rip it apart and see how you can sequence it. And of course, when you're finished doing that task, dispose of the personal protective equipment that is disposable, like the gloves, wash hands thoroughly, sanitize your other personal protective equipment that you've been wearing, items such as your hard hat. You're not going to throw that away, but that would be a good time to wash it thoroughly, since you've been in close contact with someone else. We are currently working on a toolbox talk that we'll post later today. I was just waiting for some more information on that should provide a little bit of direction to people. That'll be up on our website later today.
Thanks, Lloyd. Giorgio, anything you want to add to that?
No, I think they got it pretty much covered.
Okay. Okay. Next.
Just as a point.
Go ahead, Ryan. Yeah, please, and feel free to jump in, guys, if I don't call on you. Go ahead, Ryan.
We are still waiting to see how this is going to be enforced. So whenever possible, I highly recommend making sure that 2 meter distance is maintained at all times. There is a pretty good chance that OH&S could be enforcing that as a contravention item. So I highly recommend making sure that you're scheduling work or performing work, maintaining that 2 meter distance whenever possible.
Yeah, okay, thank you, Ryan. I think that's a good point. Next question comes from C. Duncan Construction. There's a few questions in here that are similar on this theme and some in the chat as well. Our business relies on hotel/motel accommodations. Those who have campers are using them, however, which is good, but I have concerns about using common areas like hotels and motels. Who's got some real world examples right now where you've got sites that are, or guys that are traveling to site, and how you're managing that? Anybody want to comment on that?
Sure, Mark here. Hotels are begging for business right now, and I know our company's renegotiated some rates so that we can, in a few of our site towns where we now have, rather than pairing up for hotels, we now have people single occupancy rooms. That is recommended, of course. You don't want two people sleeping in the same room when possible. That definitely increases social distancing concerns. So I would recommend, talking with hotel owners and see if you can renegotiate rates for your own workers. Also, you guys as contractors out there need to, of course, provide the tools and cleaning supplies to your own workers. So takeout food's probably safer in your own safe environment to eat versus not doing that. And unfortunately, eating can be a very social event, but probably eating separately when you're out of town is the safest way to go.
Thanks, Mark. Anybody like to add to that? Okay. Where am I in my questions here? Oh, there we go. Okay. So thanks for that. One question we had here is, has anyone developed procedures for work in a client-occupied building? From Kevin. So, obviously that's not a unique situation, but a different situation. So for those of you operating in a client-occupied building, and what are you doing differently than you might have done before COVID-19?
So I'll kind of talk on this a little bit. Whenever possible, we're isolating the areas that we're working in. And I mean, this is general construction practice anyhow, that if we can avoid having a bunch of people walking through our area, it reduces risk to us and it reduces risk to the occupants. Another option is talk to the building owner. You may have to switch up your hours, find out when they're working and work at separate hours. One of the things that you also need to consider for your worker safety coming into an occupied building is there's going to be some additional hygiene cleaning of the areas that they're going to be handling and touching, making sure that you're providing opportunity for them to sanitize their work areas. But isolating when possible, changing shifts if necessary. You may have to go to a night shift. From what I've seen, to keep work going, workers seem to have been more than happy to switch over to shifts or later shifts or alternate times to be able to keep working, maintain their jobs, and keep themselves safe.
Thanks, Ryan. Anybody want to add to that in terms of client-occupied buildings? Giorgio?
Just on that as well, I mean, establishing separate entrances from the client themselves will reduce that as well. One of the things we've done is we've isolated a couple of stairwells. One is an up, one is a down, just to eliminate the possibility of guys passing each other on the stairwells. And then if at all possible, can the client work from home? Which some of our clients have done that and reduced their staff. So now the exposure limits are also reduced on those job sites.
Okay, excellent. Lawyer Mark, anything you'd like to add to that?
I'll just add one more thing we're working on getting up on our website is just a very quick health questionnaire for homeowners before you go in there. I know there are some residential companies in attendance today, so before going into do any service work or anything like that, definitely you're going to have to sanitize your work area when you get in there, but the homeowners themselves could be a risk. So we put together a very quick health questionnaire that you can have the homeowner fill out, or you can fill it out with them. as long as you're 6 feet away, just to make sure they are disclosing whether they've traveled, whether they've been ill, anything like that, that you would need to know before entering their home. And if any of those factors do pop up, then you reschedule the work.
Thanks, Loy. Building off of that, actually, so just a question that we did get from somebody with respect to the residential, although today's conversation is primarily focused on non-residential and tomorrow's will be residential. Was from Todd and Tracy asking, it's focused mostly in the rural areas, but where residential is a main part of the work that they do, and going house to house is exactly the kind of risk you're talking about that has to be managed. So that information will be available from SCSA. But any other advice that you or anybody else on the panel would have in terms of what contractors can do to manage that risk for themselves and their employees when they have to go from site to site in a residential context?
Well, I know that there's going to be some difficulty with it. That's without question. I mean, that's the nature of this right now. The one thing that I would recommend is have a look at how TELUS and some of the cable companies are dealing with it, because they're facing the same situations as that you just described, and I don't have all the procedures directly in front of me, but I know if you contact them, they'll provide them to you. I've heard them discussed on the radio a number of times. So there are larger companies that have fully established procedures and protocols in place for that. So my recommendation is contact a large employer and see if they're willing to share with you. And I know a lot of the government businesses like SaskTel, SaskPower, they're willing to share it.
That's right. Okay. Next question. This is specific to one particular software, although I think it would apply to any safety document software that a company is using. So it comes from Dustin. He says, if we put a self-assessment tool, so this is for that pre-screening piece, if we put that tool in site docs and then get employees to complete the assessment before each workday, can we legally ask these questions before allowing them on site? And can we keep this information privately in site docs so it's only available to senior managers? So I think there's two parts to these questions is, can you legally ask people these pre-screening questions? And I mean, I think the answer is yes, but I'd be interested in, because I know you're all doing it, but I'd be interested in your perspectives. And then if you have, because this is sort of personal health information, how are you protecting the privacy of individuals within your IT systems? And Ryan, I see you're unmuted, so do you want to go first?
Well, and I don't know the questions they're asking, so I can't directly say yes or no to the individual questions, but there's a standardized set of questions that are available. You know, have you been in contact or out of the country? Have you isolated? Are you showing any signs of symptoms? There's standardized set. They're being used everywhere. As far as the Privacy Act, limited access, as long as it is specific to management or a single manager or a single point of contact that's managing, you know, let's say a site supervisor or that worker's direct supervisor and management. Currently, it's not a problem at all.
Okay.
And actually being done widespread throughout industry.
Yeah. Loy, Mark, or Giorgio, anything you want to add to that? Okay. We had a question from Daryl. This was an earlier question, asking if any of you, he was asking about a specific system called incident command systems and wondering whether any of your companies are using some of their protocols. So I don't know if anybody is, or if you know of anybody that is, but just asking the question. Anybody want to add anything to that? Okay. Next question comes from Reliance Comfort. Are surgical masks sufficient instead of N95? I think the answer to that is no, and the masks have to be appropriately approved. But Giorgio, do you want to comment on what is and isn't approved that you know of there?
No, you're exactly right, Mark. Unless they're certified through CSA or an approving agency and recognized by Occupational Health and Safety, they are not valid on site. And that's where Ryan noted to earlier that they're trying to get the K9 or KN95s approved. We're in the same boat. We're trying to do that. So once that gets approved by them, then we can utilize those. But the surgical masks are not rated for industrial use.
Thanks. from Dennis Callahan, I think, if I'm reading this question right, Loy, we'll start with you. So, good morning, everyone. In the past, the SCSA has helped me create a great safety culture, mostly with the challenges around convincing management of the importance of safety protocols. With this being a new challenge, how would you suggest a person responsible for the health and safety program convey the importance of new procedures within these times? And so Loy, will start with you, and then I guess it's, you know, if people for some reason are not taking this seriously, how do you communicate to them the seriousness and importance of this?
Okay, it's a very good question. I do know there's different levels of acceptance around industry right now on whether this is a really big risk or not. So as a safety person, number one, you have to establish your set policies and procedures. Your employer should be backing you up on that in these circumstances in particular. This is not a company situation to manage. Our government is involved in this, so we all have to comply if we're going to keep industry working proactively during this pandemic. So if people are not complying with procedures that you've put in place, and they should be, everyone knows what's going on right now. But unfortunately, one thing I would see perhaps the need for a disciplinary type of procedure in place. Obviously, we don't want to go there right off the bat. Education, training, new procedures, that's definitely the way to go. But I would also be prepared for what you're going to do in the case of non-compliance.
Yeah, good point, Loy. I've been hearing across the country the phrase comply or goodbye, you know, and that there really is no room anymore for non-compliance. But I think that part of the question is, you know, if we have a hard time convincing people that safety is important to begin with, how do we convince them now? Giorgio, Mark, or Ryan, anything you'd like to add to Loy's answer?
Well, to the question, if their employer isn't taking it seriously from what they're seeing on the news and from government orders and the state of emergency that's coming out, you know, I don't know what else you can do for them.
Yeah,
it's you know, it's pretty apparent that this is a serious situation. You know, you have to have a plan in place. If you want to protect your business, you need to have a plan in place.
Mm-hmm. Okay, next question. So this is from Jonathan. If someone is sick and it doesn't seem to be COVID, i.e. doctors not recommending testing, when should they be allowed to come back to work? Should we tell each person to stay away for 14 days? So I'm going to ask Giorgio to tell us what you guys are doing first. But before we do that, I want to be clear. When it comes to health advice, the people you should talk to are the public health officials. Amanda, can you look up the number for the Saskatchewan Public Health line that's for non-emergent? So, you know, you don't call 811. There's a general number that's been set up so you can call and ask these questions about what they recommend. And so with that caveat, though, I'll ask our panelists what their companies are doing with somebody who is not sick, or sorry, who is sick, but has been told by medical professionals that they don't need to be tested. So Giorgio?
Yeah, so what we're doing is following the recommendations of the health agencies. So we have our workers call 811. They're given directions from them. They're to follow that out. Once the actual symptoms and signs have dissipated, we're waiting 24 to 48 hours dependent on the situation before we allow them to come back to work.
Okay, thanks. Mark or Ryan or Loy, anything you'd like to add to that? Mark?
Yeah, we exactly echo what Giorgio just said, and that's the recommendations from public health. So yeah, I think he wrapped it up very good that way.
Ryan?
For us, it's very similar. Again, we have one point of contact making all the return to work decisions, so it's consistent. My recommendation is, you know, outside of what we've said here, make sure you're consulting with what is standard best practices, and you know, what the government is recommending when it comes to medical clearances.
Okay, thank you. I want to note in the chat that there's been some good resources that have been posted. MND posted a link to what I think is the BC Construction or BC Construction Safety Association. They have some resources. I would highly recommend going to the Saskatchewan Construction Safety Association, which also has great resources. Corey posted some information specifically on site docs, say that they have made templates available for COVID-19 self-checks, and they're found under the inactive forms. And as well, Allison posted some information on what they're doing to manage situations like hotels. So thank you to everybody for including resources in there. And Amanda will soon add the number that you can call for general health questions related to this. Okay, a few site-specific questions here. So one from Chelsea. With product being hard to get a hold of, how are other employers providing soap and water / sanitizer on site for employees? Also, what types of cleaning supplies are you using when things like cleaning wipes are not easy to find right now? So how are you managing the tight supply chain for these things? And yeah, what kind of products are you using? And whoever would like to go first. And Loy, maybe you can talk also about what SCSA is doing to help coordinate information about where some of those supplies are available. So who'd like to go first?
So what we're doing in this shortage is we've got a procurement officer here at the district level that works with our corporate level to source these different products. There's also a list through CDC in the States of alternatives for bleaches and that sort, and it gives you timelines as far as how long that has to be on site or contact time for that. So we're looking at things like that. Other options that we've done is we sourced hand sanitizers in larger quantities, so 5-gallon drums of this stuff instead of individual bottles. And currently here in the province as well, a lot of the distilleries have moved over to doing hand sanitizers as well. So there's options to contact those people for those types of items that you're looking for.
Thanks, Giorgio. Anybody want to add to that? Okay. So next question is from an anonymous attendee, but it talks about workers' right to refuse work. So the question is, what are the limits to workers' right to refuse work in response to the pandemic? So my first thought on that is, of course, all Saskatchewan workers always have the right to refuse work if they believe that that work is unsafe. And all employers have an obligation to take all reasonable measures to ensure that that the workplace is safe for their employees. If an employee does refuse work, there's an obligation by the employer to investigate, and that can escalate up to an investigation by the ministry as well. I can say, and I think this is a little bit of positive news, that as of yesterday at least, while there had been some Saskatchewan-based investigations by the ministry into refusals to work, there had been none in the construction industry across the province. So I think that's a real credit to the effort that construction employers are doing to make their workplaces safe and to work with their employees to ensure that they feel that way. But would anybody like to add any thoughts on the right to refuse work?
Contact an OH&S officer and discuss it with them. Find out if what you're doing is correct. OH&S has been a valuable resource over the years. You give them the opportunity to have discussion with them, find out if the workers are within their rights or if you need to change how things are. Typically, before it gets to that point, there are a lot of warning signs or issues that are coming up prior to it being at the point of worker refusal. So, as I said earlier in the call, work with the workforce that are out there on the front lines as much as possible to support what they need. And if there's a situation, it's tough to say, where is the line of where that is. That's tough because there's so many scenarios, where's the line up to, but talk to OH&S. They're there to help you. They're not just there to enforce, they're there to support as well. So.
Absolutely. Loy, anything you'd like to add to that?
No, I think Ryan covered that quite well. It's the right to refuse is always everybody's right. And this is no exception. It will be dealt with on a case-by-case basis. But I encourage you to start with your employer and see what you can get in place at your place of employment prior to taking that step.
Thanks, Loy. So a few things I saw. Daryl posted some information in the questions of access to additional cleaning supplies. So thanks, Daryl, for that. Amanda's moved that over into the chat. I see Giorgio has posted something that went to the panelists. So Amanda, if you can make that publicly available to everybody, that'd be great. And Loy has posted the information for SCSA online as well. So Amanda, if you can make that publicly available, that would be great. Okay, next question comes from an anonymous attendee. Again, a specific question, but I think it's pretty representative of a lot of challenges our member companies are facing. So we're a small company. We have 4 company vehicles, 10 employees. It's not practical for everyone to drive themselves 4 hours to the city we're rooming in, then an hour to travel back and forth from hotel to the job site each day. Rooms were priced in for 2 employees per hotel room. 1 room per employee is not in the budget. Do you have any alternatives to these 2 scenarios? So this gets at a key question, which is there's real costs that come with the requirement to comply with this, both in terms of schedule delays and real financial costs. I don't think, personally, I don't think there is an alternative. I think we have to do these things if we're going to keep operating. But can you talk a little bit about the kinds of conversations you're having with owners and with others on the job site about how these costs are going to be managed and absorbed, because there are real costs?
So what we're doing here with our company, each project is actually tracking all the additional costs surrounding this COVID-19 in attempts to go and process or bring this forward to the government and try and get that money back from the packages that they have available. So my recommendation is track everything as it's going right now, additional costs, and then talk to the government agencies that they have for these additional funding.
Thanks, Giorgio. Ryan, Mark, Loy, anything you'd like to add to that?
Unfortunately, right now, making those arrangements and picking up those costs is currently the cost of doing business as it stands right now. I mean, these are the requirements. I can get a worker to a site, you know, if I get them to drive 200 kilometers an hour, but it's not legal. So right now, this is what the government is enforcing. We have to follow those rules.
Yeah, Mark, Loy. Okay, no, Mark, go ahead.
I just echo what they said. It's the new normal, unfortunately, and sometimes you have to look at it as, you know, we're still in business. Maybe it's not quite as profitable, but we're still in business.
There is, without a doubt, going to be a financial impact for a lot of businesses over this, significant, and it's very unfortunate.
Yeah, and I want to be really clear that that is the reality that everybody is dealing with, and nobody had budgeted for this. Nobody had planned for it. I can tell you that as an association, we're having conversations with the provincial government all of the time to try and have them establish some leadership on how they're going to deal with that for their contracts, but also to provide guidance for the private sector, because we all understand that it's going to be a challenge for contractors to absorb those extra costs. But bottom line, you cannot compromise safety for budget. If you can't operate safely, you shouldn't be operating. And I don't like to say that, but that is the truth. And so you need to take it seriously, and you need to find a way to make it work. If you need help figuring out how to navigate that, you should reach out to the associations, whether that's the SCSA or to our association. Our job is to advocate for you, and we will work with you to do that. And the SCSA's job is to help you navigate the safety components of that, and they will help you do that. And so I know that isn't a good answer or the answer that you'd like to hear, but there's no way around this. You've got to comply.
Well, to further that, Mark, as well, this isn't a consideration of an individual employee. This isn't a consideration of a potential, you know, minor, you know, cut on a finger or something like that. This has broad societal impacts. You're affecting not just that worker, but the families of everybody, or all the rest of the workers that worker works with, their families, and anybody else that they may come in contact with. So unfortunately, there is going to be a cost involved, but this is the situation, and there are broader impacts that you need to consider. Yes, there's going to be costs that are associated with it, but we need to consider the scale of the potential. It's not a minor, and we're working to eliminate those as well, but this has very large and very broad potential.
Thanks, Ryan. So we've got about just over 10 minutes left. Lots of questions. We will do our best to get to as many of them as we can, but we won't probably get to all of them. I do promise that if we haven't gotten to your question, you will get answers after the fact, because we'll have everybody's email address, right, Amanda? Oh, we won't. Okay, so then if you've asked a question and you would like it responded to and you didn't get responded to, please send me your email with your question. So my email address is president@scaonline.ca, president@scaonline.ca. I'll be happy to take them and we will get answers for you. So thanks for clarifying that, Amanda. Okay, so here's a question. So I think we touched on this one a little bit. Do you have suggestions to deal with younger apprentices that don't have families at home and therefore may not be realizing the seriousness of the situation, especially during off hours? So those folks who are not following the social distancing that they should be outside of work. We talked a little bit about like how could you not take this seriously, but maybe I'll start with you, Mark. Anything you'd like to answer or provide to somebody who's struggling to get their younger employees to take this seriously?
I think it's going to happen everywhere, whether it's construction or any other industry. You hear stories on the news and so on about officials trying to manage folks in parks and that sort of nature. As far as your own employees taking it seriously, I think you have to look at the overall employee itself and make a determination on, what was that catchphrase that you used? Comply or goodbye.
Yeah.
Yeah.
Ryan, Lloyd, Giorgio, anything you want to
add? One of the things, and we did come across situations similar to that. We took that employee aside. You have the discussion. You're a concern for the rest of the site. You need to change your behavior, or the rest of your peers don't want to work with you. Have that conversation with them. Like I said, you need to be straight up. You need to be honest. Don't sugarcoat it. Your behavior is putting everyone else at risk, and you're a concern for the rest of the staff. And give them the opportunity to change quickly. And as Mark said, and put it very well, comply or goodbye.
Thank you. Okay. Next question is, and I guess this is still an evolving answer, but talking specifically about traveling to and from sites. So 2 questions here. One came from Daryl saying, would a plexiglass splash screen be acceptable between front and rear seats? And then another question was, would masks and gloves be sufficient if people are required to travel to and from sites in the same vehicle? So I think the short answer is the specific requirements are still evolving on that, but as much as possible, you want to avoid having people in the same vehicle. If they have to be in the same vehicles, and I don't know if any of you want to comment on what you're doing, what advice do you have for how they can mitigate that? Lloyd, maybe I'll start with you.
Okay, a plexiglass screen may be sufficient between the front and the rear seats, but that means one person in the front, one in the back. You couldn't have 2 people in the front. That would then not be sufficient. My concern would be you're still breathing recirculated air in a vehicle. So you would have to take the extra layer of having a mask on as well. Gloves are a little bit of a concern. I know that's one of the things I keep hearing over and over, just wear gloves, just wear gloves. The fact of the matter is gloves are not as easy to clean and sanitize as your hands are, and many contacts in trying to take your gloves off properly. So I would not recommend gloves unless you absolutely have to, and regular hand washing or more frequently would be the better solution to that. This one, honestly, I would have to make a call to OH&S and get their direction on this. I'm still concerned with it. The better method is to just have one person in each vehicle at a time.
I will comment too, the information that I've got from OH&S is no amount of administrative or personal protective controls are currently acceptable to have more than one person in a vehicle.
Yeah, and what I would add to that is their interpretation is evolving too, right? And so I think it's important for everybody to remember that this is new for all of us. Our society has not dealt with this in 100 years, right? And none of us in our lifetimes have had to deal with anything like this, and that includes government and everybody. And so everybody is sorting through this as best as they can on the advice of public health officials, which is the best thing we can do. What that means is that you're never wrong to err on the side of safety, right? And whatever you can do to keep people separate as much as possible and to keep them safe as much as possible is always going to be a good step to take. So I think as a default answer to all of these, if you have a choice to make between more safety or less safety, choose more safety. What facilities are being, this comes from Phil, what facilities are being provided on site for washing hands? And if provided, is the wastewater a health concern if it isn't being drained into a sewer? So how are you guys managing that on site, Giorgio?
One of the things that we've added is standalone hand washing stations like you'd see at a concert or things that way. And we've added those into the cleaning schedule. The water in that is contained into the bottom and then it's disposed of as gray water. So that's one of the things that we're using instead of, or to add to our hand washing ability.
Thanks. Ryan, anyone add to that?
Very similar. Currently, we don't have a concern for the water right now as being a potential transmitter. Like I said before, soap seems to be a very, very good way of breaking down the virus. And so typically, and I would hope they're using not just water, soap with the water is a key component there. Shouldn't be an issue. We've got a number of sites and I'm sure there's probably a way to share it, but all over our supervision and on a bunch of different sites that we're on with other contractors, they've set up makeshift hand washing stations in a variety of different ways. As I said before, we're a creative and innovative bunch here in Saskatchewan, so I'm sure there's simple, easy solutions for it that a little bit of effort and some ingenuity you'll be able to come up with.
Thanks, Ryan. Mark or Loy, anything you want to add?
One line, and stop touching your face. That'll be it.
Okay, so a couple of more things we want to try and get through. We've got about 5 minutes left. I'd like to get through 2 or 3 more questions. So here's one. I don't know if anybody's had to deal with this yet, but you probably will at some point. Does your company have a process in place today for what happens if somebody contracts COVID-19 and recovers, and then when they can return to work? So this is specifically for somebody who was sick with COVID-19 but recovers. Do any of you have policies in place for that yet? And if so, what are they?
I'm going to say for us, it's going to be as per doctor's orders and recommendations that will follow. And I don't want to sound like I'm, that's what it is. But we're consistently trying to stick to recommendations from medical professionals on it, strictly.
Yeah. I see everybody nodding. Anybody want to add anything to that? Yeah, and so, I mean, there is some guidance out there from public health about when people who have returned, who people who have been cleared of COVID-19 are able to return to work. My understanding, and again, this is just my understanding, is that you have to have two negative tests after you've tested positive. And those have to be at least, I think, 24 hours apart. It might even be 48 hours. But all of that information is available online through the Saskatchewan government's COVID-19 portal. And I would recommend that you go there to get the answers on that and build your policies according to what they have outlined. Okay, here's a question from Charles. Does anybody know of a fog or fogging device to sterilize the air of a vehicle cab? And following or adding to that, are masks reusable? I'm pretty sure the answer to that one is no. And can one spray them with isopropyl alcohol at the end of the day to reuse masks? So anybody know about ways to sterilize vehicle cabs? And does anybody want to answer the masks or are masks reusable question?
I have no idea about fogging the interior of a vehicle, so I can't speak to that. But I do know the masks currently cannot be sterilized and reused. Otherwise, our healthcare workers would definitely be doing that right now.
Yeah, and you know, as far as fogging, I don't know of anything. The CDC is a good site, like Giorgio had pointed out earlier about pointing out different methods of cleaning. Key right now, from the information I have, is hard surfaces are your biggest concern. And you know, you want to make sure you're using disinfectants properly. Every single one of them has a different amount of time it needs to be sitting, so it's wiping down and making sure that you're applying the proper procedure for the product you're using. But as far as you know, bug bomb in a car to kill off viruses, I'm not aware of anything as of yet.
Okay, I'll speak to this one since we recently had to do this. There is a fogging disinfectant that is available through biohazard specialists. One of the companies is called Brothers in Grime, and they do have this disinfectant fog. So what they'll do is they can go in, drop this basically fogging agent inside the cab of the vehicle, and it will disinfect it. Don't ask me on the cost of this. This was one of our other districts that had to use this.
Okay, thanks, Giorgio. So that's good intel. So there is some information there. And Giorgio, if you're able to send us any of that, we'll make sure that that gets out to people as well. Okay, so I think we're gonna miss a few questions here. I apologize for that. The last question comes from Brandon. I'd like to hear from everybody on it, and then we will sign off. Just so people know, again, as a reminder, this has all been recorded, so you'll be able to come back and pick up certain spots if you'd like. It'll be available for others as well, so you can share it. Our association and others will be sending the recording of this out later today, so you will get access to it. Perfect, thanks. Giorgio has posted that Brothers in Grime biohazard cleaner info. So the last question comes from Brendan Moore, and I'm going to paraphrase it. I'm going to start with you, Ryan, and we'll end with Loy. So now that we've been made aware of this virus, what do you think the long-term changes may be in terms of our safety culture for companies in the construction industry for future situations like this? I mean, this isn't just changing today. I think, Ryan, you alluded to that. It's changing in the future. So what are some things that jump out to you as things that will be different in the future because of what we've learned through COVID-19? Ryan? Well,
one of the things that I'll point out is, you know, all the regulations across Canada, there's an old saying about the regulations that they're all written in blood, and they're in there for a reason. There will be regulation changes sweeping across the country. Not only that, but I do imagine standards like Z1000 for HSE management systems will change to include pandemic standard response. This will be, my expectation is it's going to be an accepted, understood portion of a requirement of any type of safety program. So I would expect to see a lot of national certifications and CSA standards change in accordance to include pandemic response or similar circumstances. Without question, it will be part of it. My recommendation right now is get ahead of the curve. I mean, you're at a point right now where you need it anyhow. So start on your process, start on your pandemic standard, and get ready for it. You know, have it in place. As I said earlier, you need to have documented procedures to make it simple and understood out in the field. One of the things too with this, make sure you're writing it for the person reading it. There's a lot of standards that I go through and that I've seen that people have written up and been done. You're not dealing with doctors that are reading this. You're dealing with workforce. Make it understandable, make it clear, concise. But yes, it's going to change standards sweeping across the country.
Thanks, Ryan. Giorgio.
Yeah, one of the biggest changes we've noticed here is just how we conduct business. I mean, a lot of our business is now doing remote, so we're working from home. So that I can see changing how the industry itself operates in those senses. But just to kind of mirror what Ryan said, it's going to be an expectation that we develop these programs and have them as appendixes to our safety programs. Companies like IS Networld and ComplyWorks and all the rest of these that work with the clients that we work for are going to be requiring us to develop these things and then submit them for approvals. So it's going to be something that's going to change, and it's going to come on board pretty quick.
I can't speak for sure too, but with Loy being on here, I'm sure the SCSA and the core certification will include something along the lines of this eventually in the future as well. I have no doubt core certification, this will be an accessory to that.
Excellent. Okay, Mark, your thoughts on how this will change the future of safety in construction?
I think the first two folks said it pretty well. There's actually, if you haven't had it yet, yeah, you will need this as part of your plan. There was actually some companies out there though that already had this for several years, including all the way back to SARS or H1N1. So it kind of depends on your company and the evolution of your company, but definitely, like Ryan and Giorgio said, this will be now standard protocol for any company to have this in place.
Thanks, Mark. Loy, last word goes to you on this. How is this going to shape the future of construction safety?
Well, I think the first three covered it fairly thoroughly. Of course, we'll be doing a debrief and taking our learning outcomes as far as core certification and C-Core certification, and seeing what fits in those programs in the future. One big thing though, I think what we're dealing with right now will really lay a foundation of not just pandemic planning changes for the future, but how we control hazards in general. Things like site visitors and clients coming onto sites and things like that. Right now we're restricting that because of the pandemic, but I would anticipate having a look at that and what we can take from this and roll it into enhanced controls on other hazards in general on sites.
Thanks, Loy. Okay, so that brings us to the end of our webinar today. I know that there are some questions in the chat that we didn't get to, and a few questions from Trevor and Matthew on the Q&A session that we didn't get to. A reminder that you can email your questions to me at president@scaonline.ca, and we will get back to you with answers to that. Thank you to everybody who participated. A special thank you to Loy, to Ryan, to Mark, to Giorgio, and to Amanda, who volunteered their time to be part of the conversation today. Appreciate that. Thanks to all of you. Thanks for your time. Stay safe, take care, and as I said, send any of your questions to us, and we'll be happy to work with our panelists and others to get answers.